Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuhu. My dear students, today I'm going to talk about diseases of the external nose and the nasal vestibule. As you all know of, the nose itself is a pyramidal structure on the front of the face with two nostrils to lead into the nasal cavities, and the nasal vestibule itself is the most anterior part of that nasal cavity. So just stay with me. Thank you. Diseases of external nose and nasal vestibule. First of all, we talk about infection of the external nose, and the most important in that field is cellulitis of the nose. Now, as you all know, that cellulitis is subcutaneous inflammation of the tissues, so it can happen to the nose as well. And when cellulitis of the nose occurs, red, swollen and tender nose is the finding with it. Usually it involves the lower part of the nose and tip area, while the etiology of cellulitis is streptococcus or staphylococcus aureus organisms which cause it, and the treatment of cellulitis of the nose is antibiotics and analgesics. Now, this is a photo of cellulitis of the nose, and usually it's inflammation of the vestibule of the nose in the form of a furuncle or a boil, which then spreads to the subcutaneous tissues of the nose and gives the nose this kind of appearance. Now, the next we talk about nasal deformities, and among the nasal deformities, first of all, we talk about a saddle nose. Now, a saddle nose is depressed nasal dorsum of the nose, which could be either cartilaginous or bony and cartilaginous together. While its etiology, why a nasal dorsum can be depressed, it could be due to a depressed nasal fracture, which just healed in that way without any correction, or it can occur due to an SMR, submucous resection operation, in which one has taken out a lot of septal cartilage out, and it can also occur in septal haematoma as well as septal abscess, which destroys the septal cartilage, and then saddle of the nose occurs. While chronic infections like leprosy, tuberculosis and syphilis can also lead to a saddle nose. Treatment of a saddle nose is usually an augmentation rhinoplasty by filling the dorsum with cartilage or a bone, which is better, whereas if that is not available, one can fill the gap with silicone or Teflon, which is not a very good solution because silicone and Teflon have a notoriety of being extruded from the side. Now, this is a photo of a lady having a saddle nose because of nasal trauma. Our next thing is hump nose. What is a hump nose? What is elevated dorsum of the nose like a camel hump? As you can see in the picture, that can also occur as a result of a trauma, but more so because of growth problems. Now, the child has grown like that, the nose has grown like that, and in its treatment, the most important thing is to do a reduction kind of rhinoplasty in which the hump is removed and osteotomies of the nasal bones being made. And then you can see the other picture which shows a corrected hump nose. Our next slide shows a deviated nose. Also, we can call it a crooked nose. Its etiology is usually trauma during birth or neonatal period or childhood, while its treatment is rhinoplasty or sometimes combining rhinoplasty with septorhinoplasty, in which one deals with the septal deformities or deviations as well as the nasal deviations. And you can see the result. Our next slide is about tumors involving the external nose, and among which one can talk about congenital problems, in which one deals with dermoid. First of all, which dermoid is a congenital tumor. It's usually in the form of a cyst, but it can be firm or solid as well. But there is one type is simple kind of dermoid, in which there is no external opening and dermoid swelling is in front of the nasal bones without any internal communication. Whereas second type of dermoid is a dermoid with a sinus. One may have internal communication with intracranial dura or the sinuses. Now, that is a difficult kind of dermoid in which the treatment is usually excision by an ENT surgeon along with a neurosurgeon. The second thing is encephalocele, which is again a congenital swelling, and meningoencephalocele. In these two types of tumors, one can have herniation of the meninges in the form of a polypoid swelling inside the nasal cavity, which comes through the cribriform plate into the nasal cavity, and that kind of swelling may be seen in children. But the important thing about that kind of swelling is it shows a cough impulse and it may be reducible. That's the sign. But its diagnosis is usually made by a CT scan as well as an MRI. And the picture shows about a child having a swelling in the frontal area, just in front of the nose, which is in communication with the intracranial cavity in that picture, in that photograph. Now, the other thing is its treatment. Encephalocele is pure herniation, and meningoencephalocele is the dura mater coming down in the form of a polyp inside the nasal cavity, with or without some brain tissue in the swelling. Now, glioma, third thing is glioma. A glioma is a tumor which contains brain tissue, and it may present as an external swelling over the nose. So one must be very careful about these kind of swellings, because swellings in children, especially infants or neonates, may be the sign of internal communication or tumor which is in communication with the brain intracranially. So one must be very careful in these types of swellings. As the picture shows, the first picture is a picture of the dermoid, which shows some hair protruding out from the swelling over the bridge of the nose. And this is an external kind of dermoid. Whereas the second picture is a neonate with a swelling over the bridge of the nose, involving the frontal area as well, in between the eyes, and this swelling is a meningoencephalocele. encephalocele. And the next picture is of the same child having that swelling removed by neurosurgery, and the result is appealing. Third is the picture or X-ray, which is MRI of the glioma in communication, or encephalocele in communication with the intracranial cavity. Thank you. Now we come to talk about certain tumors which can involve the external nose. And among that, the first one, which is very common relatively, is rhinophyma. That tumor is also called potato tumor. It's a slow-growing tumor, and it's due to the hypertrophy of sebaceous glands, and it's seen in long-standing cases of acne rosacea. It is a pink lobulated mass over the nose, and its treatment is skin shaved off with a knife, an area allowed to re-epithelialize. And the second kind of treatment which is better, is carbon dioxide laser along with or without skin grafting. And you can see the patient's picture with the rhinophyma, and the second picture shows after its treatment. Now, talking about the malignant swellings of the nose, the first and very important is a basal cell carcinoma. It's also called a rodent ulcer, and it usually occurs among males and females above 40 years of age. Usually involves tip and ala of the nose, whereas it's got nodular form or ulcer with a rolled edge. Now this picture shows the rodent ulcer on the ala of the nose of the patient, and its treatment is cryosurgery or irradiation or surgical excision. It's not known to spread and metastasize, so it's better to treat it locally. Now this picture shows a squamous cell carcinoma, which is about rodent ulcer, we talked about earlier, is about 87%. And if you talk about squamous cell carcinoma, it takes about 11% of the population among those external tumors of the nose. It's not the 11% is involving 11% of the population, but among the malignant tumors, if you talk about malignant tumors of the external nose, squamous cell carcinoma is about 11% of the external tumors of the nose. And that is also called an epithelioma, equally common in males as well as females, whereas the age group is about 40 to 60 years of age, and it's also in the form of a nodular ulcer with rolled out edges at the side of the nose, or columella. The treatment of squamous cell carcinoma of the nose is radiotherapy in early type of lesions, where surgery is the mainstay of treatment, since this tumor can spread to local lymph nodes, can metastasize to local lymph nodes. So this is a much worse tumor than the rodent ulcer. Now the third thing is melanoma, which is the least common tumor on the external nose. Talking about diseases of nasal vestibule, the first and very common thing or disease is a furuncle or a boil. Now, Staph aureus infection of hair follicle in the vestibule of nose is called a furuncle or boil. As you all know of, Staph aureus infection is difficult to treat, whereas it is because of the picking of the nose or plucking hair in the vestibular part of the nose that causes a very painful and tender nose because of a furuncle or boil. So my suggestion is never squeeze the boil because of danger of cavernous sinus thrombophlebitis. As you all know that nose, mostly the tip area and the alar area, is in the danger area of the face, and the most dangerous thing is to have a cavernous sinus thrombophlebitis because of nasal infections. So my advice is never squeeze the boil. Okay, its treatment is warm compresses along with antibiotics and analgesics. Now, talking about vestibulitis of the nose, as the name suggests, it's an inflammation of the vestibular part of the nose. Now, its types can be diffuse type of vestibulitis, in which there is diffuse dermatitis of vestibule, and it's usually due to Staph aureus infection again. Now, acute vestibulitis, in acute kind of vestibulitis, the nose is red, swollen and tender, whereas in chronic type of vestibulitis, the vestibular skin is thick with fissures and crusts. Now these pictures show, first picture on the right top is kind of vestibulitis, which is causing excoriation of the skin of the vestibule, and you can see honey colored discharge as well as some redness and scratch marks, whereas some narrowing is also visible in it. Now this is due to a chronic type of vestibulitis. The treatment of vestibulitis, this kind especially, is not only antibiotics but an antibiotic cream containing some steroid preparation as well. So this is being applied to this area, which then can get better with it within a week or 10 days. Now the second picture right below is of a furuncle of the nasal vestibule, and you can all see that pus is coming out of that swelling, and it's due to a hair follicle infection, the vibrissae in the nasal cavity, the nasal vestibular area. One of the hair is being infected with the Staph aureus, and sometimes so much so that pus comes out of it. Its treatment again is remove the pus, whatever has come out, and apply some antibiotic cream along with some steroid and give systemic antibiotics. Third picture, which is the left, first left, is a picture of nasoalveolar cyst, which involves the nasoalveolar area or nasolabial fold area. It is underneath that area, the nasolabial fold. It's kind of cyst, which then gives rise to a swelling, and asymmetry is visible in the right nostril area. You can see, and there is filling of the area. Now this nasoalveolar cyst also can be treated surgically, and the surgery is usually done under the lip, and there's no scar mark on the face. So that's all about diseases of the external nose and the vestibule. Thank you very much.